One of the most important topics that we want to discuss today are treatment options for your fibroids. Treatment options can range from non-surgical, which would be conservative management or medications, minimally invasive, all the way up to surgical. For women without any symptoms from their fibroids, we would strongly encourage conservative management. No surgical intervention would be needed, and just watching your fibroids with ultrasounds every 6 or 12 months would be indicated. If you develop symptoms during that time, certainly you could transition over to a possible treatment. Conservative management is important. Unfortunately, a lot of physicians, once fibroids are diagnosed, want to rush ahead with a particular treatment. We want to make sure that doesn't happen to you. Some of the things that you may hear are, if your fibroids continue to grow, it may be cancer. It's simply not true. Just because your fibroids grow doesn't mean that it's cancer. There have been no studies that show that a fibroid growing or a fibroid growing quickly indicates a cancer. You may also hear that if your fibroids grow too large, they won't be able to rule out any other type of cancer, whether it be ovarian or uterine cancer. Again, that's simply not true. As fibroids grow, you can still have ultrasounds and MRIs that look at your uterus and look at your ovaries to ensure that you're not at a risk for cancer in the future. Some physicians will say that you should have surgery for your fibroids earlier rather than later so that you can have a less invasive approach. They may offer a vaginal hysterectomy and say that if the fibroids continue to grow, you would need a much larger surgery. Again, if you're asymptomatic, having surgery isn't indicated. You don't need to have surgery. Your fibroids may grow or they may not grow. And if they do grow, they may regress at a certain point and you may never need any surgical intervention. Some women diagnosed with fibroids may be trying to get pregnant and having difficulties. However, fibroids, although they can be a cause of infertility, are not usually the cause. We would recommend a woman seeing a specialist for infertility before rushing ahead with fibroid treatments. Some gynecologists will diagnose fibroids in young women and recommend surgical treatment for those fibroids so that it won't affect your fertility in the future. We certainly don't recommend that. If a woman is having difficulty conceiving in the future, then her fibroids could be addressed. Because fibroids rarely cause any severe complications other than the symptoms we've discussed, we don't recommend preemptively removing a uterus or removing a fibroid to prevent symptoms from happening in the future. Although conservative management is the proper course of treatment for most women, some women begin to have symptoms that affect their life. For those women, we do want to intervene and we do want to provide some treatments. The least invasive of those treatments are medications. Some women can be treated with hormones or with other progesterone medications to try to help limit the effects of fibroids. They can be quickly effective, however, most of these medications cannot be prolonged for more than 6 months. Women who take progesterone medications are at severe risk of osteoporosis and other types of menopause disease because their hormones are being suppressed by the medications. While that's beneficial for the fibroids, it can cause a lot of complications and thus isn't a long-term strategy. However, if you're having severe symptoms now and need quick relief, medications could be a short-term bridge to get you to a further treatment down the road. The most invasive treatment for fibroids is a hysterectomy. A lot of women offered hysterectomy, and in some instances that may be the best choice. However, there may be other minimally invasive options which you should consider. Hysterectomy is the most invasive treatment for women's fibroids because it removes the entire uterus. A hysterectomy can be done a variety of different ways, either through an abdominal incision, it can be done laparoscopically, or it can be done robotically. Some hysterectomies, depending on the size of the fibroids and the size of the uterus, can be done vaginally versus abdominally. Regardless, a hysterectomy is a very invasive procedure. It's certainly done as an inpatient with a woman in the hospital for several days after surgery. There are minimally invasive treatment options for fibroids that are between hysterectomy and between medications and conservative management. Several of the more popular are uterine fibroid embolization, myomectomy, or ablative therapies. Ablation is where a woman's inner lining of the uterus can be cauterized or heated to prevent further bleeding from fibroids. Now, this doesn't treat the fibroids themselves, but will help a woman who has severe bleeding. A woman with pelvic pain, frequent urination, and cramping wouldn't benefit from an endometrial ablation. There's also ablative procedures where the actual fibroid is destroyed and can be shrunk down. These types of radiofrequency or cryoablations are done usually laparoscopically and are done as either an inpatient or an outpatient. Myomectomy is one of the most common minimally invasive procedures for fibroids. A myomectomy is where the uterus is preserved, but a fibroid is removed from the uterus and then the uterus is closed. This can be done for a wide range of fibroids of different sizes and different types. Myomectomy is still a surgical procedure and requires general anesthesia, and depending on the size of the fibroid can be done either as an outpatient or sometimes as an inpatient. One of the other most common minimally invasive treatments is uterine fibroid embolization. Uterine fibroid embolization is an outpatient, minimally invasive, non-surgical procedure where the blood supply to the uterus is stopped and those fibroids shrink. It can be beneficial to a lot of women because it's outpatient and requires minimal recovery after the procedure.
She did not. The only option that my gynecologist offered was to have a hysterectomy, a partial hysterectomy. And so and again, I was ready to do it. You trust these doctors that they know what they're doing and that they give you all the options that are available. But again, after talking to my friends and relatives, I discovered that there's many options. And so as a consequence, I am not returning to my gynecologist. I have chosen a different one that has given me, or that is aware of all the options. I think that it all comes down to education, really, from doctors. Perhaps she's not aware that there's these alternatives to fibroid treatment. Although when you look at the internet, it's on Dr. Oz. It's kind of mainstream knowledge. I didn't know it, but you would expect that your gynecologist would. And even after I asked if there were other options, she said no. And there's no after effects after having a hysterectomy. You shouldn't worry about side effects. There's none. And I knew that there were because I talked to people who had them, and I wanted to avoid that.
My OBGYN actually recommended UFE for me, but she also informed me of my other options such as myomectomy, laparoscopic surgery, hysterectomy, and birth control pills. And out of those options, UFE appealed the most to me.
And she's a really well-respected doctor in the community. She had had a hysterectomy herself. That was what they did back in the day. She's a little bit older. And so no, I had to find this was an option myself. It did help that my brother-in-law does this, so I had called him. But if I hadn't talked to him, I might not have known that it was an option. I was really thinking hysterectomy or live with the symptoms.